I am really honored tonight to be able to join experts and stakeholders.
Councilmember Andrew Friedson recently co-hosted an informative panel discussion to shine a light on the latest fetal and infant mortality data.
Most people know their bodies, and the question is whether or not you have the information to trust what you know and what you feel and what you're going through. And I think it's our job to make sure that people have that.
Every year in Montgomery County, approximately 100 pregnant women experience a pregnancy loss or death of their infant. These tragic losses happen to women from different socioeconomic, educational, and ethnic backgrounds. Female Community Action Team co-chair Pat Keating gave a rundown of the data and resources available.
We want to give women the tools, the education that they need so that they can speak up and ask questions and advocate for themselves.
Although these tragic losses happen to women of all backgrounds and races, African American women represent the highest percentage of those affected.
21% of the deaths were white women. 43% of the deaths were Black African American women. But keep in mind that African American women only represented less than 1/4 of all the births.
I'll take that question.
Dr. Monica Howard explained that the lack of communication and attention from healthcare providers leads to people of color not receiving the medical care they need.
Because of lack of understanding, lack of health literacy, or perhaps even the provider's inability to effectively communicate to patients what's going on with them health-wise.
The importance of bereavement support was another point the panel discussion focused on. Elizabeth O'Donnell shared a personal story of loss.
My daughter Aaliyah was born still on December 1st, 2020, so we're just coming up on 2 years.
And her take on the importance of bereavement support.
I didn't want to bother anybody. And I think that that is a very important piece to get out there with birthing people advocating for themselves.
She founded Aaliyah in Action, an organization that provides women, birthing people, and families who have experienced prenatal or neonatal loss
What's in the box?
With self-care packages and bereavement supports to help navigate life after loss.
There's no words to describe what a parent is thinking or feeling when they hear those words. I partner with hospitals to give these packages to families, that the hospitals have inventory of them. As a bereaved mom walking out, you don't feel worthy of anything, and you don't feel worthy of self-care. And so it is critical for providers to kind of give that green light to a grieving parent.
Other community partners from the Smile and Babies Born Healthy programs also were present to give an overview of what their programs offer.
SMILE program is run through AAHP, which is the African American Health Program, and it stands for Starting More Infants Living Equally. And the program is intended to reduce the number of infant mortalities, premature babies, and low birth weight babies for African Americans, African and Caribbean women in Montgomery County.
The Babies Born Healthy program is a county program. We focus on moms who have Maryland Medicaid.
We've got a lot of work to do to address the broader racial disparities in our community, the health disparities and otherwise that are very much present in this issue that we heard recurring certainly through this conversation.
For information on the African American Health Program SMILE program, call 240-777-1833. And for information on the Babies Born Healthy program, call 240-777-3118. If you are interested in joining the Community Action Team to help make a change, please call 240-777-3967. From Rockville, I'm Mirchaye Sahlu.